more people seek care for pain issues than any other condition.
Well, my knees were bothering me. I had limited mobility, and they seemed to continue to get worse and worse. When I think back, I was probably experiencing a decline for nearly 2 years. And one week, it just became unbearable, and I wasn't able to walk.
Did you know that your body has the ability to heal itself naturally? Our body can repair and renew itself using its own cells. Stem cell therapy is an excellent option to surgical treatment and steroids, and can help increase the success of certain orthopedic procedures. Board-certified orthopedic surgeon and fellowship-trained in sports medicine, Dr. Joanne Halbrecht and her highly educated team at Boulder Institute for Sports Medicine offer this advanced treatment.
Conditions that can be treated with stem cell therapy are meniscus tears, rotator cuff tears, tendon and ligament tears, and arthritis as well as chronic tendinitis.
The more stem cells used, the better the result. Dr. Halbrecht tells us how it works.
Stem cells are attracted to an area of inflammation or injury. They release a variety of chemicals to promote tissue regeneration, decrease inflammation, inhibit the formation of scar tissue, as well as increase blood flow to accelerate healing. Studies have shown that stem cells increase the success of rotator cuff repair surgery, regenerate meniscus, and relieve pain in osteoarthritis. There are more stem cells in fat than bone marrow. The more stem cells, the better the response.
Now, let's learn how the procedure is performed and the benefits.
First, the patient is evaluated to see if they're a candidate for stem cell therapy. If it's determined that this is a good option for the patient, then the procedure is performed more commonly in the office under local anesthesia. An area on the abdomen is anesthetized and a small incision is made approximately 2 to 3 millimeters in length. Then a mixture of lidocaine and saline is injected underneath the skin. The lidocaine anesthetizes the area and the saline helps break up the fat for harvesting. Then a special instrument is inserted, and that's attached to a syringe that is locked open, and that provides suction for harvesting the fat. The fat is then transferred to a cylinder, and saline runs through the cylinder to help remove cellular debris and red blood cells, which are things that we do not want to inject in the joint. Then the fat is micronized, which means it's made into smaller pieces for easier injection. Once the graft is prepared, then it is injected into the knee joint, and the patient leaves the office the same day. The procedure takes approximately 30 minutes to an hour to perform. The benefits of stem cell therapy is that you're using your own tissue to heal yourself. We have the potential within our own tissues to regenerate, but it needs that stimulus from the stem cells in order for that process to occur. So what we need to do is harvest the stem cells and then place them in an area where there's inflammation or injury so the stem cells can do their job. When we look at other ways of treating conditions such as arthritis, when we take anti-inflammatories, they're not treating the underlying condition. What they're doing is treating the symptoms of the arthritis. With stem cell therapy, we can actually treat the arthritis so that it stimulates the cartilage within our own body to regenerate and form new, more normal cartilage. The success rate with a single injection of stem cell therapy for osteoarthritis has shown that 75% of the patients experience a 2-year relief in their pain without the need for any further intervention. For me, one of the more impressive procedures that's affected with stem cell therapy beneficially is rotator cuff repair. When we look at someone who's in their 70s, their failure rate is about 40%, and which means that they'll need to have another surgery at some point in the future. With stem cell therapy, we are able to decrease that failure rate to less than 10%, and this is studies that have at least a 10-year follow-up.
She talked me through the entire procedure, made me feel very comfortable, and I watched as she processed the stem cells and then injected them back into my knee. So it was relatively painless, it was fast, and I was very happy with the procedure. Within a week or so, it felt wonderful. And today I have full range of motion in that knee. I've been very happy with the progress in my right knee that I've decided to do it in my left as well.
Dr. Joanne Halbrecht and the team at Boulder Institute for Sports Medicine, helping your body heal itself.